dentistry. So one of the very important famous MCQs, what is very frequently asked about dental caries is about the causative bacteria what are responsible for causing dental caries. So students and viewers, sometimes it comes in the multiple choice questions as well as in the theoretical exams where you are supposed to write about as to what are the strains, different strains of bacteria what are causing dental caries. So starting with, so students and viewers, very important, I would like to emphasize that whenever the question is that what is the strain of bacteria what is responsible for the initiation of dental caries. So do remember that for the initiation of dental caries, the most important bacteria, the bacteria what is responsible for the initiation of dental caries is the Streptococcus mutans. Apart from this, when it comes to the question that what is the bacteria what is responsible for the progression or the propagation of dental caries, so it is the lactobacillus which is responsible for the propagation and the progression of dental caries. Another very important MCQs what is very frequently asked is about that the bacteria what is responsible for the smooth surface caries as well as the caries in the pits and fissures. So when it comes to the bacteria what are responsible for the pit and fissure caries, again it is very important that the pit and fissure caries is caused by the most important, the bacteria what is found in the pits and fissures, it is the lactobacillus. And when it comes to, they say that the bacteria what is responsible for the smooth surface caries as well as on the proximal surfaces, the bacteria what is responsible for causation of caries, it is the Streptococcus mutans. So again, very important line. I would like to once again repeat that the bacteria what is responsible for the initiation of dental caries, it is the Streptococcus mutans. Lactobacillus is present in the, is responsible for the propagation of the dental caries, that is progression of dental caries is caused by lactobacilli. The next, the Streptococcus mutans is the causative bacteria what is responsible for the smooth surface caries as well as the caries which are occurring on the proximal sides. So smooth surface caries as well as the caries on the proximal sides, the bacteria what is responsible is the Streptococcus mutans, whereas the lactobacillus, it is responsible for the pit and fissure caries. So the pit and fissure caries is caused by the lactobacillus. And last, when it comes to the root caries, so the most important bacterial species what is responsible for root caries is the actinomyces. So actinomyces is the strain of bacteria what is responsible for causing root caries. So very important, students do remember, for the initiation of dental caries it is the Streptococcus mutans. For causing the proximal or the smooth surface caries, it is the Streptococcus mutans. The bacteria what is responsible for the propagation or the progression of dental caries, it is the lactobacillus. And also very important, this lactobacillus is the causative organism for causing pits and fissure caries. So in the deep retentive pits and fissures, if the question is saying that what is the bacteria, what is the strain of bacteria what is responsible for pit and fissure caries, as well as in deep carious lesion, so the bacteria what is isolated from the pit and fissure caries as well as and the deep carious lesion, it is the lactobacillus. So students and viewers, and lastly, the bacteria what is responsible for the root caries in the root of the tooth surfaces, if the root caries is occurring. So the most important bacteria associated with root caries is the actinomyces. So students and viewers, this was a very short video where I have discussed about the very frequently asked multiple choice questions, where you are supposed to write about the bacteria what is responsible for different bacteria what are responsible for different types of caries on different root surfaces. So you have to be very specific in the multiple choice questions. So students and viewers, this was a very short discussion. Arshad Sultan is saying, can the patient consume curd? Obviously, the patient has no issues in consuming curd. Arshad, it's very important. You can text me in the comment section, patient can consume curd. So this was a very short discussion. Students and viewers, if you like this video, give this video a thumbs up. Students who are new to my channel, who haven't subscribed, and those, if you like this video, give this video a thumbs up. If you are new to this channel, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.